Hello, everybody. Welcome back to the Noon Show on TV2. I'm David Burns, and this is Ask the Expert. Today, we're visiting with glaucoma specialist Dr. Kurt Schwiesow from Tower Clock Eye Center here in Green Bay. Welcome back to the program, Doctor.
Thank you.
We want to talk a little bit more about glaucoma today, a condition that many people don't even realize they may have, and it goes undiagnosed quite frequently. But once it's diagnosed, there are several ways to treat it, including something as simple as eye drops.
That's right. Here in the United States, we do have a lot of treatment options available for glaucoma. That's not true elsewhere in the world, and that's why glaucoma is the second leading cause of blindness. But the key to glaucoma is that once you've started to lose vision from glaucoma, you really can't get it back. So the whole idea here is to diagnose it early on, start treating it early on, so that you can stop the process and preserve the patient's vision. Treatment really hinges on reducing the eye pressure. All right, so what we do is use a combination of eye drops or laser treatments or sometimes surgery to bring that eye pressure down. For the vast majority of patients, eye drops are something that's going to be required at some point in their treatment.
Okay, and it does take a bit of a commitment to the patient as well, correct?
That's right. There are a number of different eye drops out there, a number of different classes of medication. So in some instances, one eye drop is enough to help control the pressure. In other instances, we've got to move on to 2 eye drops or even 3 or sometimes 4. The goal, one of my goals with glaucoma treatment is always to try to reduce the number of medications the patient is on. So really try to limit that to a manageable number. Because, you know, we're talking about, and this is the case with a lot of situations like high blood pressure, high cholesterol, diabetes, where there may not be symptoms that drive the patient to want to treat the problem. It's not painful. They're still able to do the things they want to do. So we really need to make sure patients understand the need for treatment, the importance of treatment. But then also part of my job is to make sure that the treatment is something that they can handle.
Right, okay. And some of the future treatments that will be coming down the line here?
Yep. Future treatments, you know, if we're looking at innovations in glaucoma, the key really is to try to reduce the number of times the patient has to administer their medication, try to reduce the cost, try to reduce the side effects. So right now, a couple of very interesting things in the pipeline would be implantable devices that might release a small amount of medication over a long period of time, or injectable medications, but things where there can be an intervention in the doctor's office and then the patient might be able to go for 2 or 3 months without having to come back. Or having to put in a medication at home.
Okay, we're visiting with Dr. Kurt Schwiesow, glaucoma specialist from Tower Clock Eye Center in Green Bay. You see the website and the phone number there on your screen. If you have any questions, go to WBAY.com and click on Ask the Expert.